All right, thank you everyone for joining today's webinar. Thanks for everyone who joined last minute. I know we had a bunch of people who joined, who signed up very recently, and so we've got some really good attendance for this. We really appreciate it, especially during the holidays. So just to give you a sense of the format of today's webinar, it's going to be conversational, and we're going to hear about VoCall from the founder, Paul Cox, and also from a practice that has been using VoCall for over a year now. And that's when you have questions, please just post them into the chat, and we'll do our best to answer them. Most likely we'll take the questions towards the end, but we'll definitely make sure that all the questions that were asked will be answered. So the topic of today's webinar is going to be on scheduling, and it's specifically on VoCall, which is a voice solution that enables practices to improve on their scheduling. And I've got two guests today. The first panelist is Paul Cox, who is the founder of Magic Medical Solutions, and he was one of the inventors of VoCall. And we also have with us Monica Henderson, who is the administrative director of Alabama Neurology and Sleep Medicine, who's been using VoCall successfully for over a year, as I mentioned. Now, specifically with the ANSM clinic, they have a very challenging scheduling load with many different types of appointments. And so we thought she would be a very good person to speak to today, just because it's a more challenging application of a scheduling tool. So just to set the tone for today's discussion, scheduling has been called the lifeblood of every practice, and especially more recently with the holidays coming up, it's becoming even more challenging. Providers take time off, and so do staff. We already have been facing a situation with staff leaving practices. It has been tough retaining them. If some of you attended a previous webinar that we co-hosted, we talked specifically about the retention issue of staff. And we know that only makes things even more difficult. On top of that, we're upon flu season, and so the number of patients isn't really going down that much during this time either. So this really creates a challenge in practices, and many practices we know are looking at a variety of different solutions, from trying to hire more to even outsourcing some of their calls in. What we're going to talk about today is technology solutions, and specifically we're going to talk about a technology solution, VoCall, which uses voice technology, which is becoming increasingly popular now to enable to take off the load from the front desk a little bit. And while just to set the stage, this is not the only solution there. We have many solutions that we see being used. There's been scheduling apps, which are becoming more popular. What we find is there's a place for each one of these solutions, and really we see practices taking on more than one solution as being optimal. So what I'll do is I'll start off with showing you the solution VoCall. And I am the client success manager with VoCall, and I directly work with clients. So I can talk a little bit about the solution as well. So just to give you a sense, VoCall is a voice solution that helps practices manage their appointments by having patients be able to call in to cancel, reschedule, and confirm their appointments. So it's doing one part of the entire role. It's completely customizable, meaning practices can go in and allow VoCall to take on some of the roles and not others. And so what we've seen is this has been a really good benefit for practices that are just looking to reduce some of that workload and take off some of the workload off of their front desk staff and give them some breathing room. So on that, let me kick off and show you what VoCall, what the tool actually looks like, what it actually sounds like, so you can hear for yourself. All right, so this is me calling into a live clinic environment.
Welcome to appointment scheduling. I am here to help you manage your existing appointments. First, I will need to ask you for some information. Can you give me your telephone number, starting with your area code?
Yes, it's 205-555-0122.
Now I need to confirm who you are. To help me understand you, can you tell me your date of birth like this? March 12th, 1980?
March 2nd, 1990.
Thanks for your help, John. Please stay on the line while I take a moment to get your information. I can help you find, reschedule, or cancel an existing appointment. What would you like to do?
I'd like to reschedule my appointment.
Please stay on the line while I take a moment to get your information. I have found 2 appointments for you in the calendar. The first appointment is with Dr. Manning on May 7th at 9 a.m. The second is with Dr. Manning on September 1st at 9 a.m. Which one would you like to reschedule?
The first, please.
Just to confirm, you want to reschedule your appointment with Dr. Manning on May 7th at 9 a.m. Is that right?
Yes, it is.
Please stay on the line while I search for appointment openings. Okay, let's find a different time for you. The next available opening is May 10th at 9 a.m. Would you like to take this appointment?
No, that's not going to work.
Okay then, I also have a couple of other openings I can offer. The first is on May 10th at 1 p.m. The second is on May 11th at 9 a.m. Would you prefer the first or second option?
I'll take the first.
All right. Just to confirm, you would like to book an appointment with Dr. Manning on May 10th at 1 p.m. Is that right?
Yes, it is.
Okay, I have scheduled your appointment with Dr. Manning. Can I help you with any other appointment tasks?
No, thank you.
Thanks for calling and see you on May 10th at 1 o'clock.
All right, so that was VoCall. So behind the scenes, what was going on? VoCall was interfacing with the practice management system to be able to change that appointment while I was speaking to Amy, the voice assistant in this case. And all this is done behind the scenes. So from a patient perspective, it's seamless. They call the same number in the practice they normally do. And the way this works is VoCall integrates into the phone tree so that the patients don't have to call a different number. They call the same number and they're able to speak to Amy. And you also heard there's multiple options that are offered, and really Amy tries to fit the patient in. If for any reason that they're not able to find an appointment, say if a provider schedule is booked up and they can't find the same appointment type, then it kicks over to a live scheduler. So it's always seen as complementing what's already there. So patients do see it as a benefit. And the best part about it is they can call 24/7, Saturday evening, Sunday morning, whenever, anytime they want to change their appointment, they can do that. It's a big added convenience for them. And you might have seen this type of technology becoming more and more popular. I recently called my Vision Works and I saw similar technology in CVS and others. And this is now becoming more and more popular, this type of technology, but used in scheduling the way it has with the Allscripts system is truly unique. And so I'll turn it over now to hear from Paul Cox, the founder of Magic Medical, who makes VoCall, just to hear his thoughts about it. So Paul, what made you come up with VoCall, or why did you see that as a need in this in practices?
Yeah, so thanks, AJ. It was a number of things. So prior to starting Magic Medical, I was the head of software with Medtronic surgical devices. And there I was very involved in starting the artificial intelligence group and also involved in voice applications. And at that same time, as you mentioned, the Amazon Alexa and Apple Siri really started to gain traction, and a lot of people were using them. And I'm sure everybody has dealt with the applications for calling their bank and having to deal with a voice assistant for that. In the early days, they weren't very good. but the technology has really progressed. But I saw that the medical community and healthcare was really behind the times of banking and some of the other areas. And I just saw a real opportunity of where voice technology could really help this industry.
Yeah, thanks. And Paul, I'm sure, when you come up with something that's new that has been tried before, there's always a uh, somewhat of a resistance to try things on. So what was your experience when you started talking to physicians and practices about it?
Yeah, good point. So, as with any new technology or new product development, we spent a lot of time talking with physicians, practice managers, various office staff. I've learned in the past it's just so important to get feedback from customers and really understand what is needed. So, we spent well over 6 months just interviewing people and understanding their needs. But not only talking with them, but we also talked with patients about finding what their needs were and what they liked. And one of the things that we found that even though there's a lot of or a number of solutions out there for making appointments or rescheduling, that a lot of people find them cumbersome. They don't want to launch an app or go to a website. They find it the nice thing about voice is it's really second nature to everybody. You just pick up your phone and just call, and so it's so intuitive and so easy. It just made sense to do this.
All right. And the other thing, Paul, that I hear from practices often is when they are in fact incorporating new technologies, uh, it's it's cumbersome, and they see, oh, I don't know, 6 months to a year of onboarding and training staff and such. And
Right.
I know from our early conversations that's been really important for you when you develop VoCall to avoid that. Can you speak a little bit about that?
Yeah, sure. So yeah, that's one of the things I've learned a lot about over the years is that the customer impression and how they interact with a product is so important. So as part of this, their experience and the installation of it, we want to make it as easy as possible for them. We realize in interviewing all these practices that they are all very, very busy. And you talk to anybody when they talk about an EHR upgrade, and everybody just rolls their eyes about, that they're just dreading it. It's not going to take just 4 hours. It's going to take the entire weekend. And when they come in Monday morning, it's still probably not going to work. So just about talk to any practice when you talk about a new software product or software upgrade, people just roll their eyes and just dread it. So we put a lot of time and effort to really making sure that this was very easy to install. There's very little input from the practice of what they need to do. And it basically you just plug it into your phone tree and we take care of the rest.
Oh, thanks. Yeah, definitely. That has become one of the big selling points, and also the installation. Can you talk a little bit about the installation and how it integrates into the practice management solution?
Yeah, sure. So our VoCall is a cloud-based solution. So there's no software to install in your office or with your EHR. We just have to have some basic information about your Allscripts PM software, what your license number is, and some basic information like that. And then we basically just interface to that. And so this is all behind the scenes. Again, there's no software to install in the practice. We take care of everything behind the scenes. And then once we have everything set up, we give the practice a phone number, and then they install it into their phone tree. And that's basically it. And typically we can do everything within about 2 weeks.
Yeah, and that's what's made it so attractive, I think, for many practices today is a quick implementation of the solution. And also, I think what has also been impressive is that it works well with other tools that are already there, meaning it works side by side with existing infrastructure that's in a practice already. So you can have Phreesia, or you can have Follow My Health or any such tool, but it just works. That improves existing performance with those tools because it gives patients yet another avenue to schedule,
Right. Exactly.
and really focuses on patient care and patient satisfaction as a driving result. So I'll kind of the next part of this conversation, what I'd like to do is to talk a little bit about VoCall being actually implemented in a practice. And And I know there's a few questions. I'll get to those questions too in a little bit. This is a practice, Alabama Neurology and Sleep Medicine, which has used VoCall, as I mentioned, for over a year. And they have, as a result of bringing in VoCall, have been able to free up the equivalent of one full-time person off their front desk. And so that has been a big improvement. They've also seen a reduction in no-shows. And initially we were looking at that saying, wow, it's over 30%, 30 to 40% reduction year on year and month on month, even accounting for seasonality. So that's very impressive. And a lot of that has to do with the fact that now that patients can actually just call in and reschedule. Having it that convenient for them to reschedule makes it easier to just do that versus not show up. And so that has reduced costs by over $56,000 when you look at the average cost per appointment that they have. So it's been that has been a very good top and bottom line improvement. But more importantly, this has made their clinic more accessible to patients and improve morale within their practice as well. And so what I wanted to talk to our next panelist, Monica Henderson. She's on the administrative side of the practice, and she'll talk a little bit about using VoCall and how that worked, their experience with working with VoCall. So Monica, over to you. Can you tell me a little bit about how what your first experience was when VoCall came in at ANSM?
First experience, it was different for our schedulers because it was a new concept for them. Initially, it was kind of difficult for the schedulers to understand what type of response they were going to get from their patients and what type of improvement it was going to have in them day to day, because it was so hard for them to understand or believe that it was actually going to work and that it was actually going to reduce, a lot of their phone calls. When we here at our office, we had already basically did an analysis of, we have 5 schedulers. We have 8 providers, 5 schedulers. One's a new patient scheduler, and then the other 4 are your already established patients scheduler. And figuring out that about 50 to 60% of their phone calls every day were either, I don't know when my appointment date and time is, I need to cancel it, or I need to reschedule. And so those mundane things, they were missing more phone calls than they were able to accept. So once they understood that when you call in our office now and you hit the option for scheduling, if you're already a patient, it takes you to VoCall, it takes you to Amy. And so she starts out and she can eliminate so many phone calls. And once they actually seen that, okay, I used to not ever be able to answer the majority of my phone calls, now I actually can, because it's not ringing as much. And then what y'all were talking about with no-shows and stuff, a lot of people just want to cancel. They don't even want to reschedule. Well, this gives them the option to do that at 9 o'clock at night when their phone or their tablet or whatever reminds them they have an appointment tomorrow at 2 o'clock. And they're like, well, rats, I forgot and I can't go. So they can call right then. They can cancel it the next morning. We know we can adjust the physician's schedule, based off of the way it looks. So when they started realizing not only did it help them with their phone calls and all that, it became a great experience. So at first, everybody was reluctant to yeah, who's going to want to talk to this? How's it going to work? Because so many people are so automatically, when you start hearing a recording, you're like, oh, great. Now anything that Amy finds or that a patient responds back to that Amy cannot provide that patient the right answer, it is going to knock it out to a live scheduler. So you don't have to worry about the patients getting so frustrated. They may be frustrated with an automated system initially, but pretty much that's the way it is everywhere now. But with this, it's not going to make them, I guess I'm saying, go around the world to get somebody. is going to automatically realize, okay, I can't do this, or they're not understanding me quickly, and it'll kick it out, to its live scheduler. So it doesn't allow the patient to get frustrated. And that's what a lot of our schedulers originally thought, is that it was going to be an additional automated system that was going to irritate. By the time they got on the phone with the patient, they were going to be frustrated with the situation, but that's not the way it works. So
right, but that's really good to hear. And I know when we first spoke about this before VoCall, there was quite a bit of churn at your practice, and it was really eye-opening for me, and I know many others from the technology side, when we hear about what schedulers actually do and how little it's understood, that all the tasks that go on. Can you paint a picture of like the day in the life of a scheduler or someone answering phones?
Every practice, I'm sure, has their front desk, checkout, scheduling, referrals, all kind of set up where people have dual roles usually. It's very uncommon nowadays that you just do one task that day. So at our office, our 4 main schedulers are also our checkout. They check out our patients. So we have a front desk, and then we have so in the world here, in the world of scheduling, period, everything's becoming more and more complex, mainly related to insurance requirements and things, or the physicians, what they require, and each physician may have different requirements. So in our world here, you've got people constantly coming to your desk, and you're also responsible for answering the phone, for scheduling for those physicians or whatever. And so here it's basically nonstop all day. And a lot of the things that when a patient checks out and the doctor wants to order 5 things for them, well, you're usually unable to complete it all. You've got to go back and do something later on, especially if you're referring out to another specialty or referring out to a different clinic. And our schedulers seem to realize that all they could possibly do was get somebody checked out and answer the phone. They could never follow back up or handle the other things that were actually the most important thing that patient was waiting for you on. So they felt as if the phone was basically making it where they couldn't take care of completing what that doctor wanted them to do. But the phone also is the only way you're going to get the patients here. So for scheduling purposes, so they felt torn between a lot of things. And this has enabled them to be able to now focus on the details of all their other aspects of their job. So every office, I feel like, regardless of if it's set up the way ours is, still the schedulers have more than one responsibility for that day. And usually they're going to have 2 or 3 things they cannot complete that has some trickle down effect to causing them more time or whatever. And this has really allowed them to take, at least per scheduler about 1/4 of their day and give it back to them every day.
All right. And really all these giving back that time is so valuable to the practice, because that's time that is now spent reading patients or taking care of important billing paperwork or other tasks that are more revenue generating for the practice. So this is not just about, we talk about, saving 1 full-time equivalent. Well, it's really putting that resource to more productive use. That's what that to me was a very powerful use of case with VoCall. Yeah.
Our goal was never, of course, to eliminate anybody or get rid of anybody. It was actually to be able to keep who we had, where they didn't go home every night and, debate whether they were going to try to come back the next day or not to that workload. And it was also because there are every day, every medical clinic finds a new responsibility or a new process or something like that they've got to go through for whatever that clinic does. So if you're able to take this one person and say, okay, we're going to train you now on how to do this, 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 and this, because these are our new tasks, where you would have been hiring somebody else, so, and then of course with revenue and everything else, hiring somebody when reimbursement and healthcare changes so drastically, you just can't just keep adding to your payroll.
Right. All right, I'll ask you the question that everyone wants to know, which is, how did the physicians look at this? I know, and I spoke to dozens and dozens of practices every week, and so I've heard how physicians are very protective of their schedules, and people don't want their schedules to be messed with. How did bringing in a solution like this work at your practice?
The physicians really didn't get concerned at all because Amy only reschedules what a human has already scheduled. So the patients have to already, Amy does not do new patient scheduling because there's too many factors into that, insurance and what they're being referred for and all that. So somebody has already made this appointment for this patient. So it's already has an appointment type and it already has the provider and the time length of your appointment's already been preset in your PM. So all Amy's doing is taking exactly what's in PM for that patient and finding the next spot that would allow that to go that has all the same specifications. So she's not going to give anything that the patient can't have. And so when they realized that there's, I guess, potentially always some slight error in something, but so far, we've not seen any kind of incorrect rescheduling. We've not seen any kind of incorrect, it's not accidentally put it on somebody else's schedule. We have not seen that error because it's already denoted, attached to that patient's appointment in PM. And so when they realized, okay, well, she can't mess it up. The only person that can mess it up was the person that originally made the appointment. Amy can reschedule something incorrectly if the first person did it incorrectly, but she can't mess it up.
Right. That's actually, that I know has been really important. And also once practices see that, it becomes easier for them to understand because VoCall isn't trying to solve every issue or take over scheduling. We're just reducing the workload from the scheduling staff by doing mundane tasks.
Right. Basically, the physicians were all for anything that would allow the schedulers to be able to take their phone calls, handle their voicemails, because you're not always going to be able to answer, but handle their voicemails and not have patients come in and say, it took 3 days to hear back from y'all, or it took 2 days to hear back from y'all. And so they were basically saying anything that can allow the staff to be not give immediate gratification, because that's kind of what people want sometimes now, but to be able to take care of patients in the time increment and time fashion that it should happen in. And a lot of days, voicemails, it was impossible to return them in a day.
Right. Yeah, that's really powerful, I think. And I know when we first talked about VoCall, what was there's a concern of, well, when you bring in new technology, this training and this onboarding required. How have your staff looked at VoCall? Are they accepting of it?
They thought, partially, I think at first I thought it was too easy to be effective. Like, okay, how's this actually going to work? Well, we didn't do anything. There was nothing for the employees to do whatsoever. All it literally was, now we have a phone tree here, so all it was putting the option in the phone tree when they selected a button that it goes to the number that's provided by Magic Medical, by y'all when we did our onboarding, and it goes to Amy, period. And so there's nothing that the staff really needs to know. Now the staff needs to understand what she does. What is VoCall actually doing? What's the patient hearing? So letting them hear some of the demos and examples and things like that, so they knew exactly what was occurring. That way, if a patient did get kicked out to them and had questions, they would know how to instruct them to utilize it properly the next go around, and say, hey, that's there for you if you need it. And if she can't find what you need, it's going to come back to me. But so they needed to hear it to know what the capabilities were and how it was going to kind of look on the screen. So like for the people that are listening that use PM, the appointments, if you ever want to go see who made an appointment, it's got a person's like username on there. You can tell who made each appointment. Well, this actually pops up and it says Magic Medical Solutions. Like, that it was this device, or not this device, this program that actually did your appointment for you on the, for that patient. So just basically showing the staff, here's what it's going to look like if Amy reschedules an appointment, and here's how you'll know what she's done, and then here's what she's found, here's what her capabilities are. That's really all they have to know. There's no training. Right. I mean, because basically you've basically integrated in your practice a scheduler that can do 60% of the phone calls that took no training whatsoever, never had to tell her one rule, one thing, whatever, because the appointment was already made. So there's nothing to do, nothing.
Yeah, I'm sure. Yeah, that is a welcome change for many. So
Now,
let me take
we have a lot of different appointment types. So a lot of different like that. And there were a few of them that we didn't want her to reschedule because they are scheduled in a time increment for a reason. And so like it's supposed to be every 3 months, every 6 months, every 90 days. And so there were things that we did not want Amy to be able to do. So you can go in, and we deactivated and did not let Amy reschedule certain appointment types. So of course, those patients, when they go to Amy on our phone tree and it pulls up and it's that appointment, then Amy's going to say, I'm sorry, I'm not able to help you, and transfer straight out to a live person.
Right.
So I just want to point that out.
Yeah, there's actually one of the questions that just came up as well. There's certain appointment types that I do not want VoCall to schedule. Is it possible to set it up? And yes, it is. And that's
as long as you're using appointment types, and so if that person's asking that, they know what that means. So yes, you can take, when we basically, Magic Medical says, we got your say not IP, but your license and all that kind of stuff. And basically they were able to say, or I think it was somebody else that said you, AJ, at that time, but they were able to give us a list of, here's your providers, here's the list of all of your appointment types,
right? Which
ones do you want on and off and all that kind of stuff.
Correct. It's completely customizable for an application. In fact, what we find is some practices start off with fewer appointment types that they allow, and then as they get more comfortable with it, they'll add more to it. So let me switch over. There's a couple of questions here that are related to the integration into the phone tree. So how does VoCall integrate into my phone tree? Paul, do you want to take that?
Yeah, sure.
And let me just kind of combine that with another question here, which is, how does the person speak with someone in the office if they need to?
Yes, yeah, sure. So as far as integrating into the phone tree, it's basically we give the practice a phone number, and either depending on what kind of phone system they have, it doesn't really matter what kind of phone system they have. They basically just plug that phone number into their phone tree. So if option 4 on their phone tree was for scheduling, then that our phone number that we provide, it goes into that option 4. And so whenever a patient calls in, they select option 4, it automatically goes to VoCall.
Great. Yeah, it's a very simple integration. The other on that same topic is, what are the hardware requirements for VoCall?
Yes. So basically, there are no hardware requirements. There is no software to install. Everything is cloud-based. So all we need is just some basic information about your Allscripts PM license, and then we just do a software interface, which is totally behind the scenes and doesn't involve any kind of interaction from the staff.
Okay, great. Good.
Let me answer the question about how do you talk to somebody at the office if you need to. So for us, our phone tree, we have like 8 or 9 options. And so we have a phone system that we were able to talk to our phone provider and say, can we add a option, in our phone tree? And so we chose to add an option. We used to have, just as an example, like say 2 was scheduling. Well, since we have a lot of new patients, we're a specialty clinic. So we have a lot of new patients. So we chose to add one that says, if you're a new patient to the practice, never been scheduled before, press this. And if you're an existing patient, press this. When they press it, it dials the number that was provided to us by Magic Medical, and then it goes to Amy. Okay, so then what your phone tree or your phone company or what ours did was link it to where, if Amy couldn't help it, it kicks out and it dials back into the office to that extension that option number 2 was already linked to before. So basically you're shooting out to a phone number and then it shoots it right back in to the original extension it was going to go to when the person hit 2 anyways. During working hours, that person's phone's going to ring and they answer it and say, hey, this is, Monica at Alabama Neurology, how can I help you? If it's after hours, if a patient calls in after hours and Amy can't help them, it's going to go to that scheduler and they have a voicemail. And so it'll say, I'm sorry, I'm unable to, answer your call at this time. They'll leave a voicemail that scheduler will be able to get off of her phone the next morning. That's how ours is linked up.
Yeah.
And then as far as there's also a whole list of words, because that was one of our questions initially, was how can a patient get out of that quickly and not go through it if they're agitated by it or whatever. And there is a long list of words that if they say it, it's going to automatically not, throw them out to a live scheduler. So, but we've not had a problem, because I also was concerned about, okay, so everybody's immediately going to start saying transfer, receptionist, attendant, or whatever. And they really haven't. I mean, they've been fine with that just because, again, people are so used to it. And because I think if there is a problem, it throws them out super quickly.
Yeah, I think people are getting a lot more comfortable with these now, and so that is going on. One last question, which is, how does the assistant do with different languages? As at this time, it's in English, but I know it's in the works to have a Spanish version of it as well. So currently, I know this question does come up. Paul, you want to address that anymore?
Yeah, just as one more point. Yeah, so we're already working on that. So hopefully sometime next year, we should be coming out with a Spanish version of it also.
Yeah, great. All right, thank you. Let me just quickly summarize our conversation and then talk about, okay, so next one, sorry. Okay, so just in summary, this VoCall, the virtual assistant, just plugs into the phone tree. It's a certified integration with the Allscripts practice management platform. And the impact of it is it frees up approximately 1 full-time equivalent for an 8-provider practice. That's a rough rule of thumb. It is in many cases more than that. We're being a little conservative, and one of the big things we're seeing is reduction in the number of no-shows, primarily because of the ease of rescheduling. Being able to call 24/7 is a huge advantage. And then finally, it's also very patient focused. It's intuitive, as I mentioned, highly customizable. You can choose to turn things on and off. You can start off slow and then add more features to it as you go. But more importantly, it allows patients an avenue to do some of these routine tasks without having to download an app or without having to leave voicemails and go back and forth with practices. So for practices who are concerned about phones not being answered or about patients not getting top level satisfaction, this is a really good tool. So pricing for VoCall is $99 per month per provider. It's very simple. Take the number of providers that you have scheduled and per month 99, and there's a $450 one-time setup fee for that. So and also now we're offering a free 3-month trial at no charge, and that includes no setup or no per provider charge. We really want to have practices give this a try. It can be canceled anytime, so there's no obligation to sign up for anything in the future. But we really want to give any practice that is looking to reduce the workload or struggling with high call volumes an opportunity to make use of this tool. Again, it's a no charge 3-month trial. So if you are interested in this, please reach out to me. My email is there. It's ajoshi@getvocal.com. And I'd also be happy to answer any other questions that you may have about VoCall or about how it would work for your practice. So on that, I don't think we have any other questions, but I want to thank everyone who participated and also want to thank our panelists. Thank you.
Okay, thanks.
Bye.
Bye.
Have a good day.
You too.